I'd like to thank the folks who were here with me today. I want to start with Alderman Rod Sawyer, who's the chairman of the Committee on Health and Human Relations, Chicago Community Trust CEO Dr. Helene Gale, who hopefully you know, but I will emphasize that she helped lead the vaccine planning for the National Academies of Science, Engineering, and Medicine. Rhodelyn Bedford is a nurse at Stroger Hospital's Intensive Care Unit. Dr. Geraldine Luna, Medical Director at the Department of Public Health, and of course, our Public Health Commissioner, Dr. Allison Arwady. We are here today to provide the latest updates regarding Chicago's preparations for the COVID-19 vaccine distribution, covering anticipated timelines, logistics, prioritization groups, and how we'll be approaching our planning through an equity lens. The leaders standing here with me today will provide further details on these components in a moment, but before they do, let me offer a brief overview of where our preparations currently stand. While we are very excited about the vaccine developments we are seeing overseas and here at home, we need to remember that widespread community vaccine distribution in Chicago is still many months away. I want to emphasize that point because I don't want people to think that they can stop doing the kinds of public health directives and using the tools that we've been talking about now for many, many months, not the least of which is wearing a face covering when you go out in public. I want to reiterate that the following federal guidance on the prioritization of groups to receive the vaccine first. Our job is to prepare and help facilitate that process as efficiently and safely as possible. With that in mind, here are the latest updates on COVID-19 vaccine distribution in Chicago. Pending final approval from federal regulators and based on guidance from the Advisory Committee on Immunization Practices, that's a mouthful, we expect to receive 23,000 doses of the vaccine starting next week. And on this point, I want to make something clear. 2 doses are needed for 1 person to be fully vaccinated. Every vaccine in the queue except for 1, but the leading ones require 2 doses. That's very important for us to remember. So following that first distribution, we will shortly have an additional 23,000 doses available to complete a vaccination of the first group. This will be for healthcare workers who treat COVID-19 patients or who conduct health and medical procedures that put them at high risk for the virus. So the first tranche of the 23,000 is going to frontline healthcare workers who are at high risk of the virus because of their treatment of COVID-19 infected patients. Each of Chicago's 34 hospitals will have the vaccine and our support in its distribution. And Dr. Arwady will talk about this, but we've been working with hospitals and planning now for some time to make sure that they've identified the people within their hospitals, that they have the storage capacity available, and that there's a real effort being made to make sure that those workers actually get the dose in an effective way, and that there's follow-up to make sure that we are learning everything we can about the vaccine as it's being delivered. Following the delivery of that first round, we will be opening vaccination clinics for healthcare workers by appointment only in late December and into early January. I want to emphasize this is going to be appointment only. We don't want people randomly showing up and thinking that they can get the vaccine. Again, under the CDC guidance, there's a very specific cadence and protocol on who gets access to the vaccine and what the sequence is. We also expect to receive additional doses of the vaccine every week and could have over 100,000 doses by the end of 2020. But again, keeping in mind, it's 2 shots. Now let me make a note for perspective. While 100,000 sounds like a lot, to put it in perspective, we estimate that there are approximately 400,000 healthcare workers in Chicago, encompassing doctors, nurses, and many other hospital staff. So while we're excited and prepared about the doses of vaccines that we expect to be receiving between now and the end of the year, we are going to only be able to immunize a fraction of the frontline workers that are going to need it over time. After healthcare workers, priority will be given to residents and staff at long-term care facilities, as well as workers serving in essential and critical industries such as emergency services. That group will then be followed by individuals with underlying medical conditions that make them at high risk for COVID-19, as well as adults who are over 60 or 65 and over. And from there, it'll go on from there per federal guidance. For specific information on all these details, residents can visit our city's COVID vaccine website. That's chicago.gov/COVID/vax, VAX. At this moment, our timeline for widespread distribution, which I will say again is months away, remains very fluid due to a lot of factors at play. And not the least of which is what will be the manufacturing capacity and distribution of the various vendors who are seeking FDA approval. So we'll know more about that in the coming days, but we can't give a specific timeline beyond this initial tranche of getting the vaccine. However, our singular goal is for every Chicagoan to have safe and easy access to the COVID-19 vaccine as soon as possible. And I want to emphasize, folks, at no charge. That's important for people to know. And our hope is that all Chicagoans will be vaccinated sometime in 2021, and we're going to do everything that we can to get that vaccine to people across our city as expeditiously as possible. Obviously, we don't control the speed of the manufacture, but when we get it, we will be using the infrastructure that we built up to make sure that we're putting it out there and available for people to get vaccine. As I noted during our last update 2 weeks ago, we have been preparing for this stage of the pandemic since the virus really first reached our city. Building upon vaccine distribution systems that have been in place for years and working closely with our partners in the healthcare community to ensure the most effective process possible when that vaccine arrives. As Dr. Arwady will attest in a moment, our Department of Public Health is, as we speak, working with partners at all levels of our city's distribution chain to ensure our residents can receive this vaccine as quickly and as safely as possible, particularly in our communities most impacted by this terrible virus. When the time comes, this will entail putting in place flexible programs to ensure equitable access that will be able to accommodate different setups and different environments, ranging from large centralized sites such as the city colleges to mobile sites deployed at trusted community settings and high traffic community areas with the support of our racial equity rapid response team members. Now, I want to pause on this point for a moment. Central to our focus on equity is the participation of trusted community partners, both in the form of medical professionals, but also in the form of local leaders, who will be crucial in helping us get the word out and ensure folks feel comfortable getting this vaccine, which in turn will protect themselves and their communities. And I also want to thank these folks in advance for their efforts. They have been a crucial part of our COVID-19 response since this pandemic hit Chicago back in really February, and certainly throughout. After the year that we've had and the sacrifices and tragedies we have all experienced, this news about the vaccine is really nothing short of tremendous. It does give us hope. It does let us see light at the end of the tunnel. But as a doctor who was with us 2 weeks ago said, we need to remind ourselves we are still very much in the tunnel. We are not out yet. And we've got to continue to make sure that we do the things that we know can protect us. Wearing a mask, social distancing, limit our exposure to crowds. Don't let folks in your house that are outside of your family unit unless it's essential workers. It would be a terrible tragedy if we were to let our guard down now. We're starting to see a little bit of an uptick in cases and positivity, which we were watching because of the Thanksgiving surge. It's concerning, but again, Dr. Arwady will talk more about that. But we have to, meaning you, me, everybody that you know, has to remain diligent, because the vaccine is coming, but it will not get to a large group of Chicago residents for many months now. Now, let me just emphasize again, please, folks, wear your mask. It's not political. It's about saving lives. Socially distance, wash your hands regularly, and stay at home and avoid travel if at all possible. These are critical things that we now know through a lot of data, a lot of anecdotal evidence, are the kinds of things that actually save lives. This is going to be essential as we move into the next phase of this pandemic, and it's going to be essential to get our kids back in school, to make sure that our businesses can reopen, that our economy will start to revitalize itself, and that we feel a sense of normal after this very difficult time. We've got to stay diligent. We need everyone's help to be able to do that. And now it gives me great pleasure to bring to the podium Dr. Helene Gayle. You've heard me say this before here and in other venues. Dr. Gayle has been a godsend to our city. She has stepped up in significant ways and used the platform of the Chicago Community Trust to help so many people in need across our city. She's a great gem for us, and I'm grateful for her leadership. Dr. Gayle.
Thank you very much, Mayor, for your kind words. You know, we got to step up when we got a mayor like you who works night and day to make a difference for our city. So thank you so much, and thanks for your kind words, and really ditto on all the words that you said about what we can do today. I think it's so important to remember, even though we're so enthusiastic about the vaccine, that we continue to think about the things that we can do today that will continue to make us and our families and our loved ones safe. So let me just say a few words about the study that I co-chaired for the National Academies. This summer, the CDC and the NIH commissioned a study by the National Academies of Science, Engineering, and Medicine to provide an independent and evidence-based framework for the equitable allocation of a COVID vaccine when it became available, understanding that at least in the beginning, the demand would exceed the supply. We were asked to do that before the vaccine was ready so that policymakers like the Advisory Committee on Immunization Practices, or the ACIP, had a foundation upon which to develop more specific recommendations when an actual vaccine was available. We were guided by key ethical principles that related to this particular pandemic, including making sure that the framework emphasized maximum benefit given the immense health and economic impact of this virus, equal concern, affirming that all life had equal value, and mitigating health inequities given the disproportionate impact on communities of color. We developed an allocation criteria based on risk: the risk of acquiring or transmitting the infection, the risk of severe disease or death, and the risk of negative impact on society. From there, we developed a 4-phase allocation framework, putting those with the highest risk in the earliest phases. And very similar to what the mayor has said, the first phase included frontline healthcare and emergency workers, people with health conditions that put them at severe risk for severe disease or death, and the elderly living in congregate settings. The phases continued from highest to lowest risk category, and the final category included low-risk people residing in the United States regardless of legal status. There were a couple of important features we focused on, the most important being equity. Because we focused on the risk to develop this framework, those at greatest risk, those on frontline essential jobs, those in congregate settings, the elderly, those with pre-existing conditions were prioritized. These are the very same risk factors that have also led to the disproportionate impact on people of color. Additionally, across all of the phases, we recommended that the census tracts that were highest on CDC's social vulnerability index, that includes factors like low socioeconomic status, minority status, crowded households, et cetera, also be prioritized. By doing this, we tried to focus on the factors that put people of color at risk, recognizing that it's largely social and economic versus biologic factors at play. Another important focus was on vaccine hesitancy, or people's willingness to get the vaccine. After all, the point of developing a vaccine is to make sure that people get vaccinated. Yet polls still show considerable reluctance about getting the vaccine, with only 42% of African Americans, 61% of whites, and 63% of Latinx saying that they're willing to take the vaccine. 3 of our recommendations focused on this issue of vaccine hesitancy, and another recommendation focused on the issue that the mayor mentioned, making sure that there were no out-of-pocket costs, making it inaccessible or too expensive for people to get the vaccine. So this is why I'm so encouraged by the efforts of that the mayor mentioned that will make all communities, especially those most hard hit by this pandemic, have the information as well as the access to this vaccine. Let me just close by saying how proud I am to live in a city that has been a leader in tackling this pandemic, as difficult as that has been. I look forward to working with the city to assure that as we roll this out, we do it as effectively as possible and keep the importance of equity at the center. So thank you, and I will turn it over now to my colleague, Dr. Arwady.
Thank you, Dr. Gale. Yeah, we really are so lucky to have someone who is the national leader in this space right here in Chicago. We really appreciated our conversations and thoughts as we think about how to roll this vaccine out in a way that works for Chicago and is distributed and has uptake in the places where it is most needed. So first, let's do a very quick review of our COVID data. We are seeing COVID-19 cases in Chicago on the rise again. As you can see in this graph, and we'll post this online at chicago.gov/coronavirus, latest data right up at the top. We had this very big spike. We hit the top of that spike in early to mid-November. We'd been coming on the decline, and then unfortunately, just after Thanksgiving, we've started to see those cases rise again. Now is the time, if you've let up, to get even more serious. We saw a lot of testing happening in the week, particularly leading up to Thanksgiving. Some of that was because people had been exposed to COVID and we had a lot of people with symptoms, but we know that there were people getting tested because they were perhaps planning to gather or planning to travel. I would encourage you to continue to think in the way that you were maybe thinking before Thanksgiving about the risk of COVID, because the risk is not gone, and we need to turn this increase around again in Chicago. Similarly, our test positivity across the city is now at 13.3%. That means about 13% of the tests that we're doing are coming back positive. That's a little bit better than we were at the peak, again, mid-November, where we were at 16%, but we'd gotten as low as about 11%, and now we're seeing it start to tick back up again. Also, as we've said virtually every week, this is not evenly distributed across the city. We've seen increases in every zip code, every age, every race, ethnicity, but we continue to see communities, particularly on the northwest and the southwest, and to an extent on the far southeast, hardest hit. In dark blue on this map, these are the communities, while the city is at 13% positivity, these are still seeing between 20 and 26% positivity. So we continue to push additional testing resources, additional outreach work. You've heard us talk about the Protect Chicago initiative, which is working to really make sure, and we're going in some cases house to house and business to business in some of these hardest hit zip codes to make sure people are getting the information and the resources that they need to stay healthy and to help protect themselves, communities, and Chicago against COVID. Deaths also have not yet peaked here in Chicago. We were averaging 2 to 3 deaths a day all summer, and we're up at a point where we're averaging 17 to 18 deaths every single day just among Chicago residents here. You heard us talk in mid-November about the risk of potentially having 1,000 more Chicagoans die by the end of this year. We've already seen about 450 just since that last announcement. We really don't want to hit that threshold. On the plus side, we are excited about the possibility of a COVID-19 vaccine on the horizon. Tomorrow, the FDA will be meeting the advisory committee to consider what's called the emergency use authorization application from Pfizer. Pfizer's created a vaccine, and the FDA is looking at all of the safety and efficacy data that the company had to submit. And the FDA will make a decision about whether to grant this authorization. That is the first step that would let us be closer to starting to vaccinate here in Chicago. The second step is after the FDA makes its recommendation, the CDC has to make its recommendation through, you've heard, the ACIP, the Advisory Committee on Immunization Practices. They will be meeting, if the FDA grants the emergency use authorization on Thursday or Friday or Saturday, however long it may take. If they make that decision, then the ACIP and the CDC will meet, also consider the data, and make the actual recommendation to vaccinate. Once both of those federal recommendations are in place, Chicago can begin vaccinating. As you heard, we will be starting with our hospitals. All 34 hospitals in the city of Chicago, our 26 acute care hospitals and our 8 specialty hospitals will all be receiving vaccine really within approximately the same first week. Some of them have the ability to hold ultra-cold vaccine, some don't. The city is covering the ones that don't have their own ultra-cold storage to ensure that whether our healthcare workers are working in a big hospital, a small hospital, a safety net hospital, an academic hospital, access to vaccine will come at the same time. We then will be working to push vaccine to our long-term care facilities. You've heard me up here week after week talking about the very high rate of cases and deaths we've seen in long-term care facilities. We also disproportionately have in both residents and healthcare workers, Black Chicagoans working in long-term care facilities. It's another reason why it's a high priority group. So we'll be working probably in the second and third week to ensure that, again, all 128 long-term care facilities in Chicago, both staff and residents have access to vaccine. And then, as you heard the mayor say, down the line, we'll be thinking about other healthcare workers and then waiting for additional federal guidance to see about other priorities. But equity absolutely is at the center of every bit of our planning here. Very briefly, the Pfizer data that was submitted to the FDA is available for you to look at. FDA.gov, if you would like to see all the pages related to this vaccine. We'll be posting some of the highlights on chicago.gov/coronavirus. We have a vaccine tab right up at the top, and we are updating that every single day, and we'll continue to be with new resources, new guidance as we learn more. But at the highest level, we're getting a lot of questions about this Pfizer trial, and I just want to make sure you understand how it works. There are about 44,000 people who volunteered for this trial. They're all 16 or older, and half of the people who volunteer get the real vaccine. Half of the people get a placebo. They get an injection, but there's nothing in it. The people don't know if they've gotten the real vaccine. The doctors don't know if they've gotten the real vaccine. Everybody goes about their regular lives. They're encouraged to wear their masks, do their social distancing, and then we follow everybody in this trial, these 44,000 people, to see who gets COVID-19. They look at all of the safety data to make sure we're not seeing severe side effects or anything that at all suggests this vaccine would be dangerous. The good news is that in this initial data, there were no specific safety concerns, and that's with a median or an average of 2 months of follow-up after the second dose. So that's very good news around safety. And the news around efficacy, how effective is this vaccine, also looks really good. So they're following these about 44,000 people forward, and at the time they lifted the curtain to look at how well the vaccine was performing, 170 people had gotten COVID-19 in this trial. 162 of them had gotten the placebo, the dummy vaccine, and 8 of them had gotten the real vaccine. And so where we say this vaccine was 95% effective in preventing COVID-19, that's because 95% of the people who ended up getting COVID had not actually gotten the real vaccine. And you can look at this data online, but what this is showing is on the bottom is time, marching forward in time. Everybody gets the vaccine at the beginning, and then the red dots represent people who got the placebo, the dummy vaccine. Each of these dots is somebody getting COVID. And so you can see for about the first week, people in the dummy vaccine group and people in the true vaccine group were getting COVID at about the same rate. But then starting just about 10 days after that vaccine, on the bottom, that blue line there, you see people who were getting the vaccine much, 95% less likely to get COVID-19. Whereas in the red line, we saw people who'd gotten the dummy vaccine continue to get COVID. Really good news, better than people were expecting in terms of efficacy. The last thing I want to say about the data is that there are side effects that were reported after getting this Pfizer vaccine. We'll be posting this online, much more data about it. But I do want you to know that we want people to understand side effects are the result of the body producing an immune response. They're not unexpected, but we did see about 78% of the people in the trial saying they had some pain at the injection site. About 59% of the people said they had some fatigue. They felt tired after getting the vaccine. Now, about half that many people who had not gotten the real vaccine, had gotten the placebo, also said they had some fatigue. But nevertheless, it does look like people who get vaccine have, it looks like for a few days, perhaps some more fatigue or headache or muscle pain. Those are not COVID-19. You cannot get COVID-19 from this vaccine. But as we learn more about this, we'll be sharing this with you as you are making your own decisions about getting COVID-19 vaccine. I also just want to note that there will be ongoing safety monitoring, not just in the trials, but among people who receive the vaccine. And here in Chicago, we have a COVID vaccine scientific work group. We'll post these names online if you want to see who's involved. But these are scientists and physicians here in Chicago with a lot of experience related to vaccines, related to FDA processes, related to safety. And we'll be turning to them as an advisory group and a work group for us as all of this data is coming out. They'll be looking and watching parts of the FDA meeting tomorrow, which you can also, it's live streamed if you're interested in following it, and helping us make sure that the recommendations that we're getting are based in the science. I have every confidence in the FDA, and this will be a Chicago group that will help ensure that the data that we're sharing is scientifically sound. So you'll be hearing more about all of this to come. But as the mayor said right at the beginning, we're excited about vaccine, but we'll be starting with a relatively small number of people, possibly as early as next week, if these vaccines get approved. I think it would be more likely to be later in the week, and I don't want people to fixate on a specific date yet, but to know we're ready as vaccine comes. We have plans that flex up or flex down. We've done all the logistics to ensure that we can get this vaccine where it needs to go, with a focus first on hospitals and long-term care facilities, and we will grow this every single week as more vaccine becomes available. And with that, I will introduce Rhodelyn Bedford from Stroger Hospital.
Good afternoon. My name is Rhodelyn Bedford. I will spell it for you, R-H-O-D-E-L-Y-N, Bedford, B-E-D-F-O-R-D. I'm a registered nurse, and I work at the intensive care unit of Stroger Hospital. I'm here today to tell you that I've seen a lot of suffering from COVID. I've literally seen my patients suffocate from their lungs being destroyed by the virus. I have seen family members unable to spend those last moments comforting their loved ones. I have seen nurses and co-workers, healthcare workers, get sick and die. But today I have a message for you. We have a vaccine available. I will get it, and I hope and encourage all of you to do likewise. This year has been a year of isolation, sickness, and death. Today is the beginning of a return to normal. Please, continue to wear your mask, wash your hands, observe social distancing, and get the vaccine. Thank you.
Good afternoon. My name is Roderick Sawyer, and I serve as Alderman of the 6th Ward of City of Chicago, and am pleased to serve as the Mayor's Chairman for Health and Human Relations here in the city. I want to thank everyone here today, and particularly Mayor Lightfoot and her leadership during this pandemic. As the nurse stated previously to me just a minute ago, this year we've experienced death, destruction, isolation, but yet I think we are all thankful for being here. We pray for those that have passed on, but we're still here, and we want to make sure that we remain here and remain healthy. So as it relates to this, I want to make sure that people understand that the dissemination of the vaccine is going to be done first from the federal level to the cities, but most importantly, the cities will maintain directives on how it's going to be distributed locally. And we want to make sure, and we know that the mayor and her staff and everyone here, all of us together, will make sure that equity is a part of the distribution of the vaccine. There will be a lens of equity to make sure that those that are most enabled, most in not desire to need this vaccine will receive the vaccine. In the meantime, do what's health, science has got us this far. Continue to trust science. Continue to wear the mask. Continue to socially distance. Wash your hands. Make sure that you keep unfamiliar people out of your home. These are the things that we know that are tried and true that will prevent the spread of COVID. Now, particularly in the Black community, we've had issues as relates to equity in vaccines in the past. We acknowledge that, and we want to make sure that science dictates what goes from this point forward. Science is the name of the day. We want to trust science in making sure that we have a vaccine that's protecting everyone. So when we go forward, when the vaccine becomes available, make yourself available for it. Please, I think it's going to save lives. We want to make sure that we're all accessible, but please, this is not going to happen overnight. Continue the protocols that we've talked about over and over again. But when the vaccine becomes available in your area, please take advantage of it. It will save our lives. It will resume us getting back to normal, where we can have a vibrant city of Chicago, where we can have dining back indoors, where we can have, you can hug someone once again and enjoy each other's company. So let's please stay vigilant and follow the directions of science. With that, I now introduce Dr. Geraldine Luna from the Chicago Department of Public Health.
Thank you, Alderman Roderick. My name is Dr. Geraldine Luna. Mi nombre es la doctora Geraldine Luna y soy directora médica del Departamento de Salud Pública de Chicago. Hoy tenemos buenas noticias. Esperamos compartir con ustedes actualizaciones a los preparativos de la distribución de la vacuna del COVID-19 en Chicago. Estamos entusiasmados con los desarrollos de la vacuna en el extranjero y también a nivel nacional. Pero debemos recordar que faltan meses para la distribución general de la vacuna en Chicago. Además, quiero reiterar que estamos siguiendo las guías federales sobre la priorización de grupos para la distribución de la vacuna y estamos usando el Comité Asesor en Prácticas de Inmunización. Nuestro trabajo es preparar y ayudar a facilitar este proceso de una manera eficiente y lo más segura posible. Pendiente de la aprobación final de la regulación federal y según la guía federal, esperamos recibir 23,000 dosis de la vacuna a partir de la próxima semana. La comisionada acaba de compartir con nosotros que Pfizer acaba de entregar los documentos a la FDA y en diciembre 10 se va a decidir si está aprobada o no para el público en general. Esto es una muy buena noticia. Recuerden, se necesitan 2 dosis para que una persona quede completamente vacunada y para garantizar ese 95% de efectividad que se probó en los estudios de investigación de estas farmacéuticas. Entonces, después de esa primera distribución, tendremos 25,000 dosis adicionales para completar la vacunación del primer grupo. Esta cantidad inicial limitada de dosis será para trabajadores de la salud que tengan o que traten directamente con pacientes de COVID o que realicen procedimientos médicos y de salud que los ponen en alto riesgo de contraer el virus. Cada uno de los 34 hospitales de Chicago contará con la vacuna y con nuestro apoyo en la distribución de esa vacuna. También esperamos recibir dosis adicionales de la vacuna cada semana y podríamos tener decenas de miles para el fin de año. Pero tengan en cuenta que hay aproximadamente 400,000 empleados de la salud, incluyendo médicos, enfermeras y otro personal de hospital. Después que los trabajadores de la salud sean vacunados, se dará prioridad a los residentes y al personal de los centros de cuidado a largo plazo o el hogar de envejecientes, también conocida aquí como nursing homes. Y luego de los trabajadores, entonces se tomarán los trabajadores en industrias esenciales o críticas como los servicios de emergencias. Incluyen nuestros paramédicos, policías y otros de estos grupos esenciales. De ese grupo seguirán personas mayores de 65 años e individuos con condiciones médicas subyacentes que sean de alto riesgo de contraer el COVID-19. Para más información en esos detalles, les exhorto que visiten el sitio web para la vacuna del COVID de nuestra ciudad, chicago.gov, /covidvax. Y VAX es V-A-X. Al momento, nuestra cronología de distribución general, que repito, aún faltan meses para la vacunación, sigue siendo muy fluida. Y eso se debe a los factores que cambian continuamente. Sin embargo, nuestro objetivo es que todo habitante de Chicago tenga un acceso fácil y seguro a la vacuna del COVID lo antes posible y sin costo. Repito, completamente gratuita. Y nuestra esperanza es que todo habitante de Chicago pueda vacunarse en algún momento dado del año 2021. Estamos colaborando con aliados en la comunidad médica para asegurar que el proceso sea lo más eficaz cuando llegue la vacuna, particularmente en nuestras comunidades más afectadas por el virus. Cuando llegue este momento, esto implica poner en marcha programas flexibles para asegurar un acceso equitativo que podría adaptarse a diferentes circunstancias, que van desde los grandes sitios centralizados como los colegios, también conocidos city colleges, o sitios móviles comunitarios y áreas comunitarias de alto tráfico con el apoyo de nuestro equipo de respuesta rápida de la equidad racial. Un aspecto fundamental de nuestro enfoque es la equidad en la participación de voces comunitarias, tanto en la forma de nuestros profesionales médicos como de los líderes locales, quienes serán integral para poder apoyar la comunicación y ayudar a las personas a que se sientan cómodas al recibir la vacuna. Lo que nos protegerá, esta vacuna nos va a proteger a todos nosotros y a nuestras comunidades, a la gente a la que amamos. Quiero agradecerle a todos de antemano por sus esfuerzos. Después del año que hemos tenido, los sacrificios y todas las tragedias que hemos vivido y soportado, esta noticia es increíble. Sin embargo, por muy emocionado que sea y por muy emocionante que sea toda esta situación, quiero recordarle que faltan meses para la distribución general de nuestras comunidades en Chicago. Y como dijo la comisionada, los números han subido. Les pedimos encarecidamente volver a lo que funciona. De un 16 bajamos a un 11 y otra vez estamos en procesos de subir. No podemos seguir permitiendo que ocurra. Y las muertes ya andan en 450 desde la última vez que dijimos que podríamos tener 1,000 muertos antes del final de años. Sería una tragedia bajar la guardia en este momento. Mientras la vacunación está en curso, debemos permanecer diligentes y responsables con respecto a las cosas que sabemos que nos protegen. Use la mascarilla, mantenga distanciamiento social de 6 pies o más, lávese las manos con regularidad, quédese en casa si puede y sobre todo evite viajar o recibir personas que no son parte del núcleo familiar en estas festividades. Así podemos detener la propagación de este virus y todos tenemos que de verdad poner de nuestra parte para lograrlo. Por favor, pongan de su parte. Muchas gracias y lo que viene es muy bueno, así que atentos. Thank you.
Oh, thank you. Let me highlight 2 things before I take your questions. I'm struck by the words of Nurse Bedford and the suffering that you described, that you personally witnessed. And I think it bears lifting up that our frontline workers, our healthcare workers, have experienced incredible trauma this year. And we've seen it in videos and stories from all across the country, but this is happening right here in Chicago. And I know we've said this before, but they really deserve our praise and our support for everything that they're doing to try to keep their patients safe, to try to ease their suffering, but even in their death, to be there for them in many instances where their families can't be there. So I just want to say thank you very much to our frontline workers. I also want to say that, and I neglected to say this earlier, that we are working in great collaboration and cooperation with the state. We had a great call earlier today with the governor and his team. We went through a range of issues, what you would expect, and we will continue to work well with them because that's what the situation demands, and we will do that. And as I said, I think the governor and I and his team are on the same page about the opportunities, but also the challenges that we face, and we're up to it. And I want people to be reassured that we are. Now, happy to take your questions.
Mayor, I have a lot of logistics questions. I don't know if they're for you or for Dr. Arwady, but can we start with after you've gone through the list of health care and the others that you have talked about, how will people know when they will be able to get vaccinated? Will the city be keeping a list, or can people search to find their place in line?
Well, I will defer the specifics to Dr. Arwady, but as she indicated, we've been working for some time with the hospitals across the city and urging them to, with some assistance from us, to come up with their own prioritization list that fits within the criteria that the CDC has set. So we expect to work through that. And then once we get this first group of folks vaccinated, we will be setting up appointments for people to continue that process. And there's a clear cadence of prioritization set by the CDC. Dr. Gale referred to it today, but we will obviously be keeping track. We're looking at different apps and software programs for folks to be able to keep track themselves. But we are, I expect that we were going to be working and continue to work not only with the hospitals once we get through that, but we're going to be doing a massive communications and messaging campaign to let people know essentially when they're next up in the queue. As we said today, it's frontline healthcare workers, other healthcare workers, folks in long-term care facilities, both the patients and the employees themselves, first responders are at the top of the queue, and it'll go on from there. And Dr. Arwady, I don't know if you want to add more to this.
Yeah, just at a high level, we're doing a lot of work to make sure that we're planning ahead. We will be waiting for the official ACIP, CDC guidance in terms of the next levels of prioritization. But expect to see updates every single week, certainly for quite a while to come here, related to the vaccine we're receiving, who's going to be next in line. This is going to be a really dynamic process. We're ready for whatever comes, but it will not be a surprise to people when they are up in line, and we'll be talking about the outreach. The Protect Chicago initiative that we've launched as well, the center of protecting Chicago will be the vaccine. So we'll be using, we're doing all of this outreach in communities. We're doing a lot of citywide messaging. Vaccine messaging will be rolling into this, and so people will be, there will be text messages, there will be advertisements, lots to let people know as vaccine becomes available to them.
Okay, what kind of information will be required? Why don't you stay for a moment, if you don't mind?
Sure.
What will be to get the to receive it? Will you have to prove employment, age, health conditions? And will the city be tracking if you get both shots or just one?
So the city will definitely be tracking if you get both shots, because to have the protection of the vaccine, these early vaccines at least, you do need to get the 2 shots. And there was some information, for example, on that released from Pfizer that said people who had only gotten 1 dose of the vaccine were about 52% protected, and people who had gotten 2 doses were 95% effective. So we are definitely motivated to make sure people get that second dose. People will be, again, we're using a text messaging based system, and some of that is being coordinated federally. So people will have the opportunity to report out if they're having any side effects, if there's any issues. But it also allows us to do some direct communication around, the next dose. We'll be signing people up for their second dose really right away at the time that they get their first dose, and then following up with them to ensure that they get it. So that part is very well sorted. What was the other piece?
Will you have to prove employment, age,
Right.
health conditions?
Yep. So we are anticipating that a lot of this will be done actually through, for example, employers. So once we're at a point where we're talking about essential workers, we will be working with some of the large employers and then actually doing some work to align them with people who can vaccinate, so that many people will likely be able to receive vaccination even at work. Similarly, that's similar with the hospitals. They know who their employers are. Once we're moving more into general public, I think there will be a couple of things. We will be working as soon as we are able to push vaccine to partners. Our full goal is to push this vaccine to as many vaccinating partners as we can. So our goal will be that people will actually be able to get their vaccine through their provider, and we'll be asking them to prioritize outreach to their patients who are over 65 or who have these underlying conditions. Where the city is doing some of that vaccinating at mass vaccination sites, we are anticipating, again, there will be sort of an outreach piece to this, where we'll be working to help people make appointments and have some focused work in particular neighborhoods. But most likely people will be self-certifying, for example, that they have underlying conditions or that they have a particular type of employment when we do get to that stage. And we'll be sharing a lot more detail about that.
Will there be any places or events in the city where you will be required to be vaccinated to be there?
So at this point, while the vaccine is under emergency use authorization, and while there's certainly not enough for widespread, there's not any set for any mandated vaccine. I think as we learn more about this vaccine, as we eventually see full authorization, as we see more uptake, those will continue to be conversations. But at this point, it's about focusing on getting vaccine out and really getting people, particularly in these highest risk healthcare settings, vaccinated.
From CBS 2, if the vaccine is pre-positioned properly in the next week, how quickly after the CDC approves the Pfizer vaccine can the first shots begin? Hours or days?
Yeah. So there's been a lot of questions about this, and I want to just set some baseline here. this pre-positioning concept is really only about right now, before there has been a vaccine that has actually gotten emergency use authorization and has gotten the guidance from CDC. And so when we're talking about potentially starting vaccinating next week, we have the opportunity in Chicago to actually sort of order vaccine through our approved processes to hospitals only after the ACIP grants, both the FDA and the CDC have signed off on this vaccine. So if that happens on Monday, we will be placing the orders for the hospitals that have the cold storage to be able to receive it. That takes a number of days. That's why I was saying it's more likely we'll be seeing more significant vaccination probably later in next week. The pre-positioning, at least here in Chicago, just means that there is a small amount of vaccine that is available just through the Chicago Department of Public Health. And that is just that we don't have it yet, but we would anticipate perhaps receiving it. That is not going to anybody different than who would be getting it sort of in our hospitals. But we are able to receive it a little bit earlier to make sure that the logistics are in place. But everybody here in Chicago, meaning the hospitals, will start to be able to vaccinate at approximately the same time. And my guess would be later next week. We'll know more once the processes are done and once we've actually been able to place some of those orders.
Has the city figured out what kind of allotments they will be giving to each of the individual hospitals in the first round?
We have, and we've done that based on the number of employees that are at different hospitals, as well as hospitals needed to let us know how many people they were sure they would be able to vaccinate. We don't have enough vaccine, as you heard, by far, to go to all of the hospitals and all of the healthcare workers. And this ultra cold vaccine, the Pfizer vaccine, must be used, meaning in someone's arm, within 5 days of having been defrosted. So what we cannot run the risk of sending hundreds of doses to a facility that perhaps only ends up vaccinating a relatively small number of people, because we would have wasted vaccine. So part of the reason we are doing all 34 of our hospitals at once, even though there's only 23,000 doses, is that we want to make sure all the vaccine is being used. So even our largest hospitals would receive at most fewer than 2,000 doses in that first week, and our smaller hospitals might only receive a few hundred doses. But we've done that based on number of employees at those hospitals, again, really with an eye toward equity.
And what about that equity? How do you, because there are so many who are concerned that everyone, and especially those neighborhoods that have been affected the most, is that also part of that allotment?
So the initial, again, just talking about the very first week, these 23,000 doses, they are going to all of the hospitals. We've given some guidance to the hospitals related to prioritizing some of their highest risk healthcare workers. That would, again, include people who work in the emergency department, in the ICU, in COVID wards, not just doctors and nurses, but healthcare workers of all types. We know that some of the healthcare workers who are in more support roles as opposed to direct care roles also have exposures to COVID and are in many cases more likely to come from those neighborhoods that have been hardest hit. Hospitals are making their own specific decisions about exactly their logistics related to vaccine, but we will continue every week to be giving vaccine to hospitals as they show us that they're able to use it, and continuing to encourage them to move out from those highest risk health workers. We will give vaccine to hospitals for as long as they have healthcare workers who have not been vaccinated.
Last two questions.
Oh dear, I have so many more. Can we move to the mayor? There's some other political questions for the mayor as well.
Can I just also just add, one of the things that we have emphasized, and we emphasize it again today with the governor and his team, is that it's essential that we require the collection of demographic information of the people that are getting vaccinated, so we understand how this is affecting people in different neighborhoods, different races and ethnicities. So that is one of the key ways in which we're going to be tracking equity in the distribution of this vaccine. Is absolutely essential that demographic information be collected. We're going to be diligent in making sure that that is done by the hospitals who are getting doses of the vaccine.
Mayor, about schools, are you concerned there might be a strike? Are you concerned that there are polls out that show that the CTU is saying 6 out of 10 do not want to return to school? Where do you stand on going back to school? I have several questions about that.
Well, look, here's what I know. I know, based upon our experience here in Chicago, based upon study after study that comes out seemingly now every day, whether it's being reported in the New York Times, the Wall Street Journal, medical journals, that there's a serious question of equity and achievement gaps among students because of remote learning. And you've heard me say this before. Remote learning works fine for some, but it doesn't work for others. And what we're seeing here in Chicago is that our students, and particularly our students of color, are falling behind. So we're always going to be guided by the science. That's the one indicator that I care most about. But I know that if we do not create a pathway to get our students back in schools, which are safe, we've done extraordinary work, really led by Dr. Arwady personally and her team, to make sure that our buildings have the kind of equipment and social distancing practices. Staff is going to have PPE. They're going to have all the kind of things that they're going to need to be safe in those buildings. And we have done that. CPS has done that in conjunction with people in the school ecosystem, building principals, teachers, staff, support folks. People have been in our buildings all year, from when the buildings closed first back in March, all spring, all summer, all fall. There have been people in our buildings. We are highly incentivized to make sure that everyone in the school community, including teachers, are safe. I absolutely understand the concerns. I share those concerns, which is why we have done everything, and we will continue to do that. We will continue to listen. We will continue to engage to make sure that our schools are safe. But I sit here as a black woman, the parent of a black child, and knowing what resources my child has, and knowing that a lot of kids who look like my daughter do not have the kind of supports that she will always have throughout her educational career, I have a responsibility to those children, just as I do to my own, to make sure that they have every opportunity to learn and thrive. We know that there is no replacement for in-person learning. And an important thing to keep in mind is that parents who do not feel safe can opt out. Teachers who do not want to come back because they have underlying healthcare conditions, they're over a certain age, they have someone in their home, there is a process by which they can also certify that and opt out. But for me, it's the science and equity going side by side, and our kids need to be back in school.
Last question.
We'll give her a couple.
Okay,
more,
if I
obviously.
can just have two. Let's do the restaurant question as a huge one, starting with Tom Tunney. Have you spoken to Alderman Tunney?
I have.
What do you make of what happened at his restaurant? At the same time, the Fulton Market Association, they are asking to meet with you. They have looked at the Northwestern study and data that says the city, there is no link to COVID spread at restaurants. They're asking for a Zoom meeting next week. Will you participate and consider reopening some more indoor dining?
So let me take those questions one at a time. I have spoken with Alderman Tunney. He alerted me earlier this week about the issue. Obviously, I'm deeply disappointed. I've known Tom Tunney for 25 plus years. I consider him a friend, and he understands what he did was absolutely wrong. And I've heard from a number of restaurateurs about this issue. But the one thing that they've consistently said to me throughout this very difficult year for them is just be fair, Mayor. Make sure that whatever the rules are, that they are enforced uniformly, that there's no exceptions. And when people break those rules, that they are held accountable. Alderman Tunney understands that he made an intentional decision to break the rules. He didn't just break them as a business person. He broke them as an alderman who swore an oath to live and abide by a higher set of standards than the average person. And that's one of the things I've been hearing a lot from people that's made them really angry and animated about this. So the alderman knows that he did wrong. He will absolutely be held accountable. Zero exceptions for that. But I understand the anger and the frustration, because this has been such an incredibly hard year. People have bent over backwards to play by the rules, and the vast majority have been. They spent and come out of their pocket at a time when they can't afford it to put together all kinds of other precautions in their restaurants to keep their employees safe, but to keep members of the public safe. And this has been horrific on them. The fourth quarter is when many restaurants and others in hospitality make the lion's share of their money for the year, and yet they're shut down. Now, this Fulton Market Group, I will just tell you, I never appreciate hearing that somebody is demanding a meeting with the mayor for the very first time through the media. I think if you're serious and you have something you want to bring to my attention, you actually just contact me, and you don't through it through the media. So I'll find out the particulars of that, and we'll deal with it in the normal course.
Last two this time.
Do you see indoor dining increasing at all in the next months ahead?
I think that's hard to say.
reopening?
I think that's hard to say in the next month, because as you saw from the data that Dr. already shared, while we were going down, we're seeing a slight dip up. We've got to understand better whether we're having this Thanksgiving bump or not. Look, I'm anxious as anybody to get our restaurants back open. I truly am. As somebody who actually likes to enjoy and go out and eat, the fact that restaurant after restaurant after restaurant is shuttered, and some are never coming back, this is a hardship on our city. It is wreaking havoc on our economy. But we've got to do it, and I think people of goodwill understand that. We've got to do it when the science tells us it's safe.
From John Byrne at the Tribune, why is it okay to let the Cubs defer a $250,000 payment for infrastructure work around Wrigley Field at the same time you're raising property taxes on Chicago homeowners to balance the budget?
Because the Cubs are a business like any other business, and they've suffered great hardship this year as well. What they've asked for, and what we're advocating the City Council agree to, is a deferment till next year when hopefully our economy opens up and they're going to be in a position to pay what is owed. It's not a, it's not a waiver. It's a deferment.
Last question, Marianne.
From Shia Capos, Mitch McConnell asked Democrats to drop the request for federal aid for cities and states in order to move ahead with the stimulus proposal. Can you talk about what the implications are for Chicago?
Well, I hope what Democrats in Congress will say is over my dead body. We are hurting, not just Chicago. Every single town and municipality in this country is hurting. Blue, red, purple. Independent mayors, Republican mayors, Democratic mayors. You see the challenges that we face in filling a $1.2 billion budget deficit, 65% of which is directly related to COVID impact. Over $800 million loss of revenue just in 2020, 100% of which was COVID related. I don't get Mitch McConnell. I never have and probably never will. But it would be an absolute travesty if something happened in Congress and there was not any kind of accommodation for state and local governments who are suffering, not because of pension issues, not because of longstanding structural issues, but directly related to COVID-19. I don't know what goes on in that man's mind that he doesn't understand and get it. He lives in a state, Kentucky, that has significant challenges. I'm familiar with mayors in that state. I know what they are suffering. And to basically turn your back on state and local governments at a time when we are hemorrhaging, when we are looking at severe service cuts, putting people out on the street and unemployment, cutting back on services that are actually could be a stimulus to the economy, that is unbelievably short-sighted. And I hope that the Democrats will hold firm. I know that there's a lot of posturing that goes on in Washington, D.C., but dear God, stop the nonsense. Get something done. We are hurting here in the heartland and all across our country, and we need the federal government to step up and do their job.
Thank you, Mayor. Thank you, Marianne.
Thank you.
Thank you, everyone.